My son has been in services but was discharged from the Brooker Centre last year. I rang up the crisis team and was told that he couldn't self-refer, he had to go through his GP, which we're waiting for that to happen as soon as possible, and was told that we would have to take him to Wiston Hospital for the doctors to assess him. I feel really let down, honestly.
Get more service users and carers involved, and that was like maybe mentoring or whatever, because there's still this stigma about service users, particularly service users, not wanting to actually voice their opinions. So maybe something like this video, this diary room, will have some impact on that and say that, listen, you're not going to be penalised, this is how it is, and we do listen.
Educate members of staff who've been in the profession for a number of years, because they still see it as the old way, that they know best, and don't necessarily take on board service users and carers' views. It's always been done this way, and it'll carry on to be done this way. We're not us and them, we are working together in a partnership and getting the service that we all require and we all need.
Like, why are they so blind to the fact that Alcoholics Anonymous and Narcotics Anonymous and other fellowships, such as, but they just don't want to, they just don't entertain them.
Something that doesn't do so well is the advertising and the communication. For instance, people don't know about the 5 boroughs meetings unless people are already in the system, but people outside of Hollins Park don't tend to know about these things, so maybe newspaper or media.
There's been a vast amount of changes how these services are delivered, and I don't even believe that the organisation themselves know what the final outcome will be. But as a mental health patient, this does concern me.
In terms of provisions for sufferers and carers, I'm sad that after 9 years the stories are still the same, that people still don't know where to go and still don't know how to access services. So I would like you to consider schools programmes to raise awareness, and also maybe some kind of directory. The second somebody finds out their child has an eating disorder, they can go and find out exactly how to access services quickly and easily.
It's 50-50, because I've had some social workers that will sit down and talk to me as a human being with the respect and intelligence that they can clearly see, and I've had other social workers and CPNs that just come in and patronise and say, "Oh, are you all right?"
It's not always reliably consistent at feeding back to people the results of their involvement, and frontline staff being a little bit more involved than middle and senior managers, perhaps.
Most patients see psychiatrists and see the doctor once a week for 10-15 minutes. And for the rest of the time during the week, it's observed by sort of psychiatric nurses and nursing assistants. They then report back to the doctor and everything's evaluated. A room for improvement would be to have a doctor on the ward during office hours.
The attitudes of the CPNs and the social workers and that, it's not exactly helpful. There's been times when social workers have said things that have been rather hurtful, and I don't think they actually understand that having somebody in the family that's got a mental illness, like my brother has, it's upsetting enough without the attitudes of the CPNs and social workers. The psychiatrists are rather reluctant to talk to you as a family member about the person with the illness because of confidentiality and all that. But if we don't know what's going on, how can we as family help a person with the illness? It's like running into a brick wall all the time.
I think one of the main things that I think is very lacking is suitable accommodation. We offer a very poor housing package. Carer training is something. We're getting more and more people caring and supporting people with learning disability during the day. Carers are not trained to give challenging, inspirational and developmental activities for these folks, and to bring some richness and some joy into their lives, as opposed to just babysitting for them.